Hey everybody, it's another wonderful Wednesday. It's a little it's actually sunny and 70 in Pennsylvania,
Yeah.
which is crazy. Um, we have another special guest that I love to have involved whenever I'm talking about healthcare. Um, Peter, Peter Raybold. Tell give the fans, give the people a little about yourself, just because this is only our second time having you on, so I'd like them to know who you are and what you do.
Thanks, Jim. I appreciate it. And thanks again to you for the events that you provide like this to help the clients, help the customers. So, again, Peter Raybold, Synchronized Systems. We provide revenue cycle solutions. Really fits into the situation now, this thing with Change Healthcare, because people are finding problems where they can't do eligibility, they can't do claiming, they can't do authorizations, they're having delays in payment. And we have separate solutions for all of those that bring the results to the people in different alternative methods. So if you're only using one particular, like Change Healthcare, and now you need to switch over, or you need to have another solution, we provide things like that. Plus the subject matter expertise that I provide. I've been doing this for 40 years. I've been in EDI healthcare since it started 2003. So I've been in that for 20 years, and really providing that expertise to the user, to the client, to the team member. A lot of times technology teams now want to build their own solutions. And in doing that, I provide the subject matter expertise. And then I've been in the weeds in the revenue cycle. I know all the ins and outs of that. So I can always offer a lend a hand, lend advice. And that's what I've been doing lately. The last 2 weeks have been, um, you know, I would say almost 100 calls, honestly, in giving people courtesy information, trying to help them move forward because of how basically everything, we talked about hundreds of thousand transactions that basically just stopped.
Yep. Yeah, no, and so what I wanted to get out there for, because this is our second video talking about Change Healthcare, and
Right.
I want people to really know, hey, listen, we're here to help. We're here to have those conversations, whether they're a phone conversation, a Zoom meeting, an email, whatever it may be. You can reach out to myself at EDI Support LLC. You can reach out to Peter Raybold. All that information is going to be in the details in the comments section of this actual video when you look it up or you find it or any of those things. So have the conversations, understand there's options, understand there's different ways, as they call it, and the old saying goes, to skin the cat.
Yeah.
Bad metaphor, bad visual, but it's one of those things that we can have those conversations, understand your situation, understand what you're going through, and say, hey, here's what I would do in your situation, or here's what we can do with helping you get through this situation. Because this is affecting so many companies throughout the United States. It is ridiculous how much it's not being talked about in the
In the
media
media.
and
Yeah.
giving these people an understanding as to what options are available. So, what I want to get into is, let's get into the current state. What's the current state of Change Healthcare attack? What are
Right.
you
Last
seeing and what
last
have
thing
you?
I had heard last night was, or in the last few days, that they did announce that they're hopefully bringing their services back online, or at least some of their services back online, as of the 18th. I guess that's next Monday, and we'll see what happens with that. But of course, the concern right away is it's been down for 15, 16 days now. Most people have had to make a choice. Phase one was hope, and I think hope was lost. So phase two now, and why we're having this podcast again, is to try to give people that idea that you can move on. There are other solutions out there. There are people that can give you advice, a friend, a lawyer, whatever we are to you, that we can help you, traverse that and figure out what you need to do to go forward. Because again, dollars and cents is what it is, keeping these places open, a grassroots kind of thing. I've been
Yep.
trying to talk to as many people as possible, kind of like a reporter on the street, call to duty kind of thing, of saying, let me listen to your problem, see if I can advise you. If I can't advise you, I have a network of people that can. And Jim,
Yep.
obviously you're a part of that. So, as many people as I can talk to. And sometimes you just, people are in such a situation. Let's say that their software company, this is a big one. The software company says, you know what, we're just going to hang on. They'll be back. So we're not going to make any configurational changes, and the customer can't do anything about it. So they're really hung up. Those are the poor people that I feel the worst for, because they're frozen in their product. They have all their data in there. It's in limbo. And other places have made choices and said, okay, we're going to try to help out. I'm not saying everybody is on the one side, but there is a certain amount of people or uh, support teams that have chosen that. The other ones have chosen to be fairly reactive and say, okay, we're going to make a choice for you. We're going to help you configure it. And then the third one is that the software itself is configurable, but again, the client's not getting support. So they need someone like us to kind of step in there. Sometimes, as I've been doing lately, and I've told you about this, manually editing these files manually.
Yep.
Like when in prescriptions 20 years ago, when systems were down, they went back to the typewriter and they typed in manually. Same idea. I'm going into editing the files because I've done hundreds, tens of thousands of these, so I can do it. And but again, it's just keeping your skills up to date, making sure you can help a person from top of the line down to the bottom. Which way can you help them?
Well, exactly. And this is like we had talked about, this is a matter of getting your business functioning. Whether it
Right.
doesn't, it's down and dirty.
Yep.
If data needs to get changed manually, that's what you do. If stuffing envelopes to send these paper, go for it. Here's like we can go through the font, the spacing, all of those things. There's certain criteria that need to get taken care of
Yeah.
depending on which function or feature you need to do to keep your business alive. And
Yes.
that's the part that I think a lot of people, they've lost hope, because hope isn't going to give you payment. Hope isn't going to
Right.
get those prescriptions filled. Hope isn't going to do all those things. Now we're way past that. Now it's reality. Now it's how do
Right.
we move the data? How do we take care of our people? How do we keep our business alive? How do we do all of these things? So, as we were talking about, there's loans that are out there. Go to Change. Change is offering loans. But what
Yeah,
I'm
you've heard
hearing,
about those loans too, that a lot of people I've spoken to have kind of balked at that because they go through the eligibility process and their loan is $200.
yep,
I mean, impossible, untenable to be able
yeah.
to do that.
How? I mean, with the raises of minimum wage that's going on,
True.
what's $200 gonna pay for?
Yeah. So, I
Like,
mean, there's realistic situations like that. The hospital associations have gone to the government and said, you got to help out here. This is unprecedented. So, I heard last night that Medicare now is going to be offering accelerated payments. They're going to be taking providers, the submissions that they've done in August, September, October of 2023, do an average on that, and then give them 30 days worth of a accelerated payment of that. Again, it's not, it's a loan, and they
yeah.
would be expected after 90 days or 180 days to pay that thing back. But at least it would give them something to keep payroll going, to keep the doors open. And more, maybe Medicaid will probably come through with something as well. They're pushing commercial payers to do accelerated payments as well, because over the years, I mean, as you said in the prior video, I mean, there's a lot of money flying around healthcare. I'm not saying everybody's making money, but certainly payers have had a good side of this, of being able to, collect. So in that case, now they're saying take some of that, provide it back to the providers that are really struggling.
No, exactly. And that's the whole thing is, I'm not saying, and we talked about this before we went live. I'm not saying my heart doesn't go out for everybody and anybody that is affected.
Right.
My heart really goes out for the therapists,
Yeah.
the mom and pop, drug facilities, pharmaceuticals, all of these littler individuals that literally make, say, 10% on a monthly, they pay out their bills, they cover their payroll, they keep the doors open, and they're happy making a 10% profit every month.
Right.
Well, guess
Right.
what? That 10% isn't going to cover your payroll for not being paid for 30, 45 days.
Right.
It's not going to
Or more.
happen, or more.
Yeah.
And that's where some of these people are at, is they're at, as we talked about, what is it, 18 days?
Yeah. Yeah. Something in that area. And talk about the some of the archaic ways of people going back. They're printing forms now, like you were saying. So in that case, they have to deal with alignment issues, fonts, printing within the boxes, making sure things are correct, and then running it out to USPS and making sure it's certified. Some of the other people I've communicated with have become, have voiced their opinions on that and say, make sure you send that out certified to the payer, because otherwise you're not sure that this is, that they've been received. And then even received at the payer, how's that going to be processed? How quick is that going to be? But they have no choice. It's down to zero, what they can do. So a lot
Well,
of people have done that.
exactly. And that's where, some people are like, oh, well, what's this? There is no silver bullet.
Right.
Like,
There is no magic here.
There's no
Yeah.
silver bullet that's
Yeah.
all of a sudden going to fix all of this.
Yep.
Because there's people that are, as we found out and we talked about in the last video, that have, insurers are exclusive with Change Healthcare. Well, that's
Yep.
a problem.
That is a problem.
What's going to end up happening? You have to go to their portal. Maybe you have to upload into their portal. Maybe you have to do paper. Maybe you have to do phone calls, faxes. Some people actually still have fax machines.
Right.
I don't care how you do it, even if you have to do smoke signals. Like, you got to do something that's going to get those payments and paperwork being processed. And waiting out for hope isn't going to do it. So, we have options. There's options of other clearinghouses. There's options of reaching out to Peter, and Peter can have you with systems that you can own.
Yep.
And it's pieces of which document are you doing? Are you doing an 837? Are you doing an 835? Look, what are you doing? And Peter might have an individual piece that can just handle that whatever option.
Yeah, one of the things on LinkedIn that I've pushed lately and tried to get out there is there's going to be a backlog, and how can you help with the backlog? So one of the things is that, and I've been communicating with C-suite administrators and all, they have large amounts of these 837 files, of eligibility files that they have pre-created, but now they're stuck in limbo with Change Healthcare specific information in them. So I offered a solution recently that allowed to not only if I manually did it, but if it's a large volume and we can come up with exactly what needs to be changed, we can run it through a translator and actually, repopulate those fields with the necessary sender, receiver, whatever needs to be to get those files created, or I should say updated, and then and send them out the door, because that's where it's at. There's a backlog of information, whether it be physical media, in the computer, they got to print them out, or just they got to get on the phone sometimes to do eligibility now, which before you could do 100 transactions in 2 minutes. Now it's one phone call is 5 minutes. So you can imagine the difference of what it used to be 2 weeks ago to what it is now. We've gone back to prehistoric type of days, but it has to be done.
Correct. And that's where I'm saying, people have there are options. You're not completely down and out.
Right.
Like,
Absolutely.
don't bury your head in the sand and go, I'm done. I can't do anything. Because now you're at the point where things have to do. Data has to be moved. You want to own a system, you're big enough and you're large enough, and you want to be able to bring this back in-house, we have options for that. You want to be able to outsource and use a team of individuals,
right.
We have options for that.
Yeah.
You want to move from Change to another EDI clearinghouse that's going to be customer receptive, that's going to be focused, that's going to be putting their team on the line to getting these jobs done, because they also know this is not like, you can't just mess around here. Like, people are spending long hours getting this data moving.
Yeah, one of the issues with that I wanted to mention, and this is another one of the many calls that I've taken, a few of them, in fact, have been the same. And they've come from billing companies, small billing companies. Again, not only is it, on the patient level, obviously, we talked about last video with prescriptions and with going to the doctor's office, getting your medical procedures because you need authorizations. But then the next level up is the billing company or the pharmacy. In this case, the billing company. They have a contract with their providers, and they say, well, we'll give you 5 hours for this much dollars and cents. And they send all their claims through for 5 hours. And economically, 2 weeks ago, that made sense. All of a sudden, they're spending 50 hours, but they're only going to get paid 5 hours because they're under contract. What are they going to do now?
Yeah.
Something that they made a decision at one point, which was certainly feasible and somewhat profitable, has now become, again, I use the word untenable. So
Yeah.
you have providers who can't receive income. You have the billing companies that can't receive income, even though they're trying to bill, trying to get this stuff out the door. They have contracts where everything was electronic. Now they're going back manually. They're on the phones, spending a lot more effort than they ever did before. So there's so many different stories within this whole thing, up the line, down the line, to the patients, and each one is affected.
Well, exactly. And that's where, again, leveraging our two companies and leveraging us
Yes.
helps them, because we're not just sitting back and researching a solution for, the real small company or the medium company
Right.
or
Or the
the
large company.
enterprise company.
Right.
We're researching and providing solutions all across the board. And it's one of those things that, we were talking about also before the call, is, say you have an enterprise company, major hospital organization, health group, whatever you want to classify them as, and they have a direct API with Change. And their team is going, oh my God, do you know
What am
how
I
long
going to
it's going
do?
to take
Yeah.
us to redirect that API from Change to somebody else? Peter?
Yeah. So one of the things I did is I came across a relationship which you've had before, I think, too, with Steady, STEDI. And so what they're doing, very intelligent solution, some smart guys over there, they came up with the idea that they could replace that particular API. API is, again, a programmer interface that originally went to Change. They're offering their own alternative API. And the reason for that is when you're coding software as a developer, you have to put programming statements in your program, and those statements do specific things. So what Steady is offering is an alternative to basically cut and paste sections out of the original Change Healthcare API, put in their API, and what that'll do is allow them through Availity. They have a background agreement with Availity to be able to do eligibility and to do claiming. So this is phenomenal for those places that our developers have systems that are totally down. They can now replace things with a Steady alternative and then use Availity, and everything will just go through. So there are people that are not only looking to solve problems here, but looking forward and ahead and saying, okay, we're in the situation. How can we get out of it? And Steady has been a great group. Zach Cantor is the gentleman over there, and David Cantor too. No relation, I'm told. Both Cantors, but no relation.
Yep.
But they've been really, in the forefront of this, and I applaud them for it. Their colleagues, and so that's one solution that I wanted to, put out there for those developers that are coming across listening to this, or somebody who knows somebody who is developing and is stuck in a situation with Change Healthcare with their product. They can look at certainly this Steady thing. If you look up in my LinkedIn and all, we've done posts about it, and we'll continue, as well as all the solutions that we're offering, the advice, Jim, that you're offering, your team is offering. Basically, again, it's call to duty. That's what this video is about. The last one was hope and change. Now it's call to duty.
Yep. Yeah, and the call to duty is, if you're just sitting around and you're doing nothing, and you will have nobody else to blame if change all of a sudden doesn't get done on the 18th.
Right. Who's to say it's yes, they're saying it is going to, but you can't promise on that. You
And,
can't
and,
build
and
on
you
that.
don't know the backlog that they're going to have to process.
So true. So true.
So for them to get through all of the data and chomp through all of the data, how long is that going to take? You may feed and you may send your information to them, and they may have 4 or 5 days worth of backlog that they're like, hey, yeah, we got your data, but it's not going to be processed through our system for 4 days.
Right, at least.
It's
And
huge.
then my concerns from there too is, they're going to say, well, things are stamped out. The problems have been ironed out. Have they been? I mean, it's a concern. So I don't
No,
know
it
how
is.
many people. There are certain people that are going to have to go back because they have no other choice. Other
Correct.
people who have looked at other solutions, now you're presented with, well, I currently have spent the effort to change my solution. Am I now going to go back, or am I going to stay with my current solution, or at least now I have a plan A, plan B? One of the biggest things we spoke about last time is having a plan A, plan B in this. So in the future, if plan A goes down, you have a plan B available. Unfortunately, a lot of us did not, or at least in the healthcare area, claiming and everything, electronics were going so well that people were not interested in talking about it. I know I've made several calls to people over the last few years and saying, what about looking at another solution just so you have it in the background? But they're like, no, it's fine the way it is. Everything's going well, and that's the way it is. So now everybody's rethinking, and it kind of woke up the industry about plan A, plan B.
Yeah, because this is mission critical. This is
Mission
mission
critical.
critical for these businesses.
Yeah.
And anything that you have that is mission critical to keeping your business around and alive, you need a plan A and a plan B and maybe a plan C and a
See.
plan D.
Mm,
Because that's the reality that we're living in right now. Is most of these companies are, the crying phone calls, the I don't know what to do, I don't know where we're going to be next week.
yeah.
Um, I know you've been dealing with a lot more of those calls than I have, Peter, but they rip at your heart.
They
And
really do. And everybody has a story. Everybody has a situation. And again, you want to try to help them, give them advice, give them some hope to move forward. And we've been successful. I'm not saying that we haven't. There've been a lot of people we've been able to help. But there are those situations we come across where, like, again, if the software, is not configurable, and maybe the support team hasn't been helpful, and their data is stuck in that product. We've
yep,
even talked about, what about throwing data from another source that you have into Excel using one of my translators to create the 837 separately? We can do that. Again, it's how to get the data out the door. You've said
it,
that, and it's
it
so critical.
well, and exactly, and it's coming up with solutions based on the person's or company's needs. Not not every solution is going to fit every organization that comes in, and
Right.
that's why we've done the due diligence of making sure whatever situation you're throwing at us, we can get you a solution and provide you a solution.
Yes.
Now, is that solution as cheap as change? It might not be,
Right.
but where's change got you?
Right. Right now, where are you with that? Right. Yep. Yep.
Like everybody's like, oh, well, that's more expensive, depending on what solution they're looking at. And the answer is okay. So
Right.
if you want to stick with change,
Right.
you might call me next week. You might call me in 2 weeks because change might not be there.
Right. We simply don't know at this point. So you have to pick something that we know is a functional solution, because we
Correct.
lost our function. We lost our ability to function. And
Yep.
now we're in the background, everybody is running around trying to figure things out. A lot of systems, I've even heard in, again, the C-suite administrator areas, people had to disconnect their systems completely from change and basically lock down. So people
Yep.
weren't billing, even if they could bill. They weren't billing because their systems were all offline. People like medical schools that I deal with, universities, they took all their stuff offline because they didn't know where this was going to travel. Again, if you look at how this cyber attack works, if somebody puts in malware, malware is like the computer version of a human virus, and it can be passed, it can be contagious. You get too near to somebody, it passes. In a network, you get too near, it passes. So they all disconnected for a period of time. Even if they could build, they couldn't physically build because the machines would not allow them to go out with the internet. They disconnected a lot of things, and they've slowly brought that stuff back, double protected things, and make sure. But all those situations exist now, and like you said, it's not about the dollars and cents, but it's really hard to ask somebody who now doesn't know how payroll is going to come next week in order to pay for a particular situation. That's why I think we've both taken the step of saying courtesy calls. I'm
Yeah.
not going to bill you for this. I'm at least initially, yes, I have to make money too to take care of my family, but I'm not going to do that to you. So that's all the people I've talked to in the last 2 weeks have all been courtesy. Even some of the corrections or things I've been able to do for people in short term, the first beginning part I did for free, again, in out of respect to them because they're taking care of patients. I'm trying to take care of them. And then eventually we work out, the money will come and the solutions will come.
Correct. And
So,
that's where they need the trusted advocates and the trusted
right,
advisors and people that are here on the ground doing this day in and day out. That this is what we live and breathe. We're not just picking solutions because it feeds our pocket. Like
right.
that's not
Not
how
about
either
that.
one of us work.
Right,
We're picking solutions that we believe in and providing options and allowing these people to say, okay, this is the one that makes sense for me. All right, cool. We can help you with that.
right. And it helps them to, again, get things out the door. That's where we
Yep.
really are right now.
And that's
You know?
and that's the way it's going to be. Hopefully, by the grace of God, things do get fixed for change,
Right,
because I don't want to see these companies down longer than they have to be. I don't want to see another attack happen to
right.
change.
Yeah.
These are things that are
Realistic.
realistic,
Hmm.
don't get talked about, but need to be talked about and need to be focused on what happens when this major thing occurs.
And even this is going to happen now. This backlog we talked about, it's going to be for the next few months. So situations, people are still, are going to be in that situation. So reach out. We've talked about um, data is power, knowledge is power, but together we will overcome. And I've used that in my LinkedIn messages to say, together we'll overcome. We
Yep.
have to use our networks, use our associations of people or associations in healthcare that if you hear something, you tell me, I tell somebody else, and we all work together on that to keep everybody going.
Exactly. Exactly. Well, Peter, we ran over a little bit, but
Only a
it,
little bit this time. I'm sure
yeah,
it
only a
wasn't
little
six
bit.
hours.
Yeah, but this is, again, it's great advice. We're here to help people.
Yeah,
We're here to do those due diligence. Whether it's with EDI Support LLC or if it's with Peter and Synchronized Systems, it's literally we're here. We're here to give you advice. We're here to help you out. We're here to give you options, solutions, and talk it through so that you have education.
right. And find us. Find a way to find us through LinkedIn, through Google, through all the
Yep.
platforms, all the media,
You're gonna
recommendations.
you're gonna see all those links are gonna be in the bottom of the comments of how to
Excellent.
get a hold of myself, how to get a hold of Peter. Please comment, please share, please like these videos, passing the word around. That's what we're trying to do, and we're just here to try to help as much as we possibly can. So, Peter, thank you. It was
Thank you.
another great Wednesday. I love talking with you.
Yep.
Um, we'll see what we can do to help people out in the future.
Got it.
You take care, Peter.
Yep. You too.